Hello, welcome to my channel. Subscribe or like if you like. Today we are going to talk about the medicine Oxybutinin. We will answer questions such as, what is Oxybutinin, what is Oxybutinin for, how to take Oxybutinin, when to take Oxybutinin, and we will also explain its mechanism of action, side effects, dosage, uses, contraindications, warnings, pregnancy and indications. The trade names of Oxybutinin are Ditropan, Ditropan XL, Dresplan, Nefryl, Tavor, Oxytrol. Mechanism of action of Oxybutinin. Acetylcholine competitive antagonist at the post-ganglionic muscle receptor level, resulting in relaxation of the smooth muscles of the bladder. Therapeutic indications and dosage of Oxybutinin. Oral route. Adults, 5 mg 3 times a day. In case of nocturnal urination disorders, 15 mg per day in a single dose at the end of the day. Increase to a maximum of 5 mg 4 times a day to obtain a clinical response, if side effects are well tolerated. After the initial control, a reduced maintenance dose can be introduced. Children over 5 years old, 5 mg 2 times a day, spaced at least 4 hours apart. Via transdermal patch. Apply 1 patch to abdomen, hips or buttocks 2 times a week, every 3 or 4 days. Do not apply 2 patches in the same place. 1 patch contains 36 mg of Oxybutinin, releases a nominal rate of 3.9 mg every 24 hours. How to administer Oxybutinin. Oral route. Tablet. The taste is not pleasant, and should be swallowed whole or divided with half a glass of water or liquid. Transdermal route. Transdermal patch, apply on dry and healthy skin, on the abdomen, hips or buttocks, immediately after removing it from the protective packaging. Side effects or adverse reactions of Oxybutinin. Asthenia. Dry mouth, constipation, nausea, diarrhea, vomiting, dysgeusia, flatulence. Confusional state. Dizziness, headache, drowsiness. Atrial arrhythmia, nodal arrhythmia, supraventricular extrasystolia. Blurred vision, dry eyes. Difficulty in urination, urinary retention, hematuria, nocturia, pyuria, pharyngitis. Flushing, dry skin. Pruritus and dermatitis in the area of application, patches. Oxybutinin contraindications. Hypersensitivity to Oxybutinin. Bladder obstruction that may trigger urinary retention. Gastrointestinal disorders of obstructive type, intestinal atony or paralytic ileus. Toxic megacolon. Severe ulcerative colitis. Myasthenia gravis. Narrow-angle glaucoma or in patients with shallow anterior chamber. Warnings and precautions with Oxybutinin. Liver failure, kidney failure, elderly, gastrointestinal obstructive disorders, bladder obstruction, hypothyroidism, heart failure, cardiac arrhythmias, coronary heart disease, hypotension, prostatic hypertrophy, autonomic neuropathy, cognitive impairment, Parkinson's disease, hiatus hernia. Risk of anticholinergic effects of the CNS, for example, hallucinations, agitation, confusion, blurred vision, drowsiness. Monitoring, especially in the first few months of starting treatment or increasing the dose. Interrupt treatment or reduce the dose if anticholinergic effects of the CNS appear. Risk of dental caries, periodontitis or oral candidiasis. Oxybutinin may lead to decreased saliva secretion. Situations that could raise body temperature, fever or in high environmental temperatures, heat prostration may occur due to less sweating. Risk of infection. If there is an infection of the urinary tract, establish an appropriate antibacterial treatment. Not recommended for children under 5 years of age. Liver failure and Oxybutinin. Caution. Renal failure and Oxybutinin. Caution. Interactions with Oxybutinin. Plasma concentration increased by ketoconazole, fluconazole, erythromycin. Activity increased by amantadine, piperidine, levodopa, phenylthiazines, butyrophenons, clozapine, quinidine, tricyclic antidepressants, atropine, dipyridamole. increases frequency or severity of dry mouth, constipation and drowsiness with other anticholinergics. Potential drowsiness caused by alcohol. Antagonizes the effects of gastrointestinal motility stimulants. Pregnancy and oxybutinin. There are no adequate data on the use of oxybutinin in pregnant women. Animal studies are insufficient regarding effects on pregnancy, embryonic/fetal development, delivery, or postnatal development. They have also shown minimal reproductive toxicity. The potential risk in humans is unknown. Oxybutinin should not be used during pregnancy unless clearly needed. Lactation and oxybutynin. A small amount is excreted in breast milk. Therefore, breastfeeding is not recommended during oxybutynin use. Effects on the ability to drive with oxybutynin. May cause drowsiness or blurred vision. Caution should be advised when performing activities that require mental alertness, such as driving, using machinery, or performing dangerous work.